This lecture is on Chapter 19, the heart. The heart is a major component of the cardiovascular system. The heart pumps blood to tissues in the lungs. Blood vessels carry the blood to and from the heart, and the blood itself is part of the cardiovascular system. This system is a double circuit. There's the pulmonary circuit to the lungs and the systemic circuit to the body tissues. This illustration shows the cardiovascular system with the heart in the center and the pulmonary system including the lungs and the systemic system going to and from the body's tissues. The functions of the heart are to keep oxygen-poor blood separate from oxygen-rich blood. The heart keeps the blood flowing in one direction. The heart creates blood pressure. The heart regulates blood supply. And the heart serves as an endocrine gland. The heart is about the size of your fist and weighs less than 1 pound. The heart is located in the mediastinum, in the center of the chest, and the base of the heart is actually 2/3 to the left of the midsternal line. The apex of the heart rests in the notch of the left lung. The heart is enclosed in pericardium, which is a serous membrane composed of the parietal pericardium, which is anchored to the body cavity wall, and the visceral pericardium, which is attached to the heart tissue. Serous fluid will occur in between the parietal and visceral pericardium, and this reduces friction as the heart pumps. The mediastinum is going to occur along the midsternal line, and the heart is located in this area, and it actually moves about 2/3 to the left of the midsternal line with the apex in the notch of the left lung. The heart has 3 layers: the endocardium, myocardium, and epicardium. Cardi means heart, and endo means within. So the endocardium is the inner layer of the heart wall and is composed of simple squamous epithelial tissue. This will be continuous with the inner wall of the blood vessels. The myocardium is the thickest part of the heart wall, and it is made of cardiac muscle. Myo means muscle. Epicardium is going to form the outer surface of the heart, and it will be part of the visceral pericardium. This illustration shows the layers of the heart, including the pericardial cavity containing the serous fluid. So the fibrous pericardium, or the parietal pericardium, is attached to the body cavity wall. The visceral serous pericardium, or epicardium, is attached to the heart. The myocardium is the muscle that makes up the walls of the heart. The endocardium is the simple squamous epithelial tissue on the interior of the heart, and it is called the endothelium. The heart has 4 chambers. There are 2 superior atria and 2 inferior ventricles. The right and left atria are separated by the interatrial septum. Atria are thin-walled, and they pump blood to the adjacent ventricles. The right and left ventricles are separated by the interventricular septum. Ventricles are thicker-walled, and they pump blood to the lungs and the rest of the body. These septa are what help to separate the oxygen-poor blood from the oxygen-rich blood. Let's look at each chamber in more detail. The right atrium will receive oxygen-poor blood from the superior vena cava, the inferior vena cava, and the coronary sinus. Venous blood leaves the right atrium through the right atrioventricular or AV valve. This is also known as the tricuspid valve. The tricuspid valve directs the flow of blood, preventing backflow, and it has 3 cusps, hence tricuspid, tri for 3. The right ventricle is a thick-walled pump. It contains chordae tendineae, which are fibrous cords that connect the tricuspid valve to the papillary muscle in the ventricle. The papillary muscle is nipple-shaped. That's what papilla means. Blood leaves the right ventricle and passes through the pulmonary semilunar valve. Then it goes into the pulmonary trunk that branches into the right and left pulmonary arteries. The arteries go to the lungs for gas exchange. In the lungs, gases are exchanged, and then oxygen-rich blood travels from the lungs to the left atrium. It returns to the left atrium via the pulmonary veins. Blood leaves the left atrium through the left atrioventricular valve, which is also known as the bicuspid or mitral valve, and enters the left ventricle. The bicuspid valve has 2 cusps, hence bicuspid. The left ventricle is a very thick-walled pump. It forms the apex of the heart. Blood leaves the left ventricle through the aortic semilunar valve and enters the aorta to deliver blood to the body. The first branches off the aorta are the coronary arteries, which feed the heart itself. This illustration shows the right and left side of the heart. We're looking at the frontal section here in anatomic position. So the left side is going to be on the right side of your screen, but anatomically that is the left side of the heart. Notice that the left ventricle is the thickest of the chambers. This is because it has to pump blood through the aorta and into the systemic circuit so that the blood can reach all the body tissues. When the blood is returning from the body tissues to the heart, it will return to the right atrium. Atrium means an entryway. So it will return to the entryway of the heart, the right atrium, from the superior and inferior vena cava. Veins are going to carry blood towards the heart. When you see this blue color, it means that it's carrying deoxygenated blood. So the veins of the superior vena cava and inferior vena cava are bringing deoxygenated blood from the systemic circuit back to the heart where it enters the right atrium. Then the blood will pass through the tricuspid valve into the right ventricle. And we see the chordae tendineae that help connect to the papillary muscle and the tricuspid valve. Once the ventricles contract, the blood will then go through the pulmonary valve, and this is a semilunar valve because it's kind of a half moon shape, and it will go into the pulmonary trunk and then branch into the left and right pulmonary arteries. Notice that the color is still blue because the right ventricle is pumping deoxygenated blood into the pulmonary trunk, which goes to the pulmonary arteries. Then the pulmonary arteries travel to the left and right lungs. After traveling through the lungs, the blood is then going to be reoxygenated. It will travel back to the heart from the pulmonary veins. So here we see the left pulmonary veins, there's two, and then there's two right pulmonary veins. So look, even though this is a vein, we're going to be red in colored because we are oxygenated now. A vein is going to carry blood towards the heart, and in this case, it's oxygenated. So the blood will enter the left atrium, that left entryway, and then it will pass through the mitral or bicuspid valve into the left ventricle. And here we see the papilla and the chordae tendineae attaching to the bicuspid valve. The left ventricle is a thick muscular wall which will then pump the blood through the aortic semilunar valve into the aorta. And the aorta is going to be very thick and have a lot of elastic tissue because it's going to receive the bulk of the blood pressure coming out of the left ventricle. And we can see that the aorta is going to branch into several arteries. It also will then continue on down into the abdomen and even branch into the legs. This is an anterior view of valves. You can see the myocardium and the left atrioventricular valve, which is the mitral or bicuspid because it has two cusps. And then we see the right atrioventricular valve, which is the tricuspid valve. And we're actually looking at the from the top of the heart, and so that's showing you the anterior surface of the heart, and then that would be the posterior, and we're looking down on the heart like we're above it. And so if you think about the cuspids, we have bicuspid molars and tricuspid molars as well in our mouth. So the bicuspid molars will have two kind of ridges, and the tricuspid molars will have three. So that's what bicuspid and tricuspid mean, those ridges. And then here we see the pulmonary semilunar valve and the aortic semilunar valve. Let's follow the pathway of blood through the heart in summary. So remember, it's two side-by-side pumps. The right side of the heart pumps to the pulmonary circuit, and the left side of the heart pumps to the systemic circuit. So let's trace it. It goes from the right side to the left side. We'll start with the right side. So it enters from the inferior and superior vena cava into the right atrium. Then it passes through the tricuspid valve into the right ventricle. Then the blood passes through the pulmonary semilunar valve into the pulmonary trunk. The pulmonary trunk branches into the right and left pulmonary arteries, where it then travels through the lungs. It returns to the heart through the pulmonary veins and enters the left atrium. Then the blood travels through the bicuspid valve into the left ventricle. And then it will pass through the aortic semilunar valve into the aorta, where it will then return to the systemic circuit. Also remember that the blue is going to indicate oxygen-poor blood, and the red will indicate oxygen-rich blood. So it doesn't have to do with whether it's an artery or a vein. It just has to do with whether it is oxygenated or deoxygenated. Also remember that veins travel towards the heart and arteries travel away. I always remember arteries away, AA. So here you go again, right atrium to tricuspid valve to right ventricle. Pulmonary semilunar valve to pulmonary trunk to pulmonary arteries to lungs, and then the pulmonary veins. That completes the pulmonary circuit. Then we return to the heart through the left atrium and go through the bicuspid valve into the left ventricle, and then the aortic semilunar valve into the aorta, and then the systemic circulation. There are heart sounds that are associated with the closing of the tricuspid and bicuspid valves, and they are given the lubbed-up sounds. And the lub is going to be the tricuspid and bicuspid valves. That's the S1 sound, and it occurs as those atrioventricular valves close. And then the S2 is the second sound, and that's your DUP, and that's when the semilunar valves close. So the lub is the atrioventricular valves, and the DUP is the semilunar valves. Heart murmurs are abnormal sounds that result from a deformity in the structures of the valves, and it will make kind of a whooshing or swooshing sound. This illustration shows the osculation points for hearing the sounds of the heart. And the aortic valve sounds are heard in the second intercostal space in the right sternal margin. The pulmonary valve sounds are heard in the second intercostal space at the left sternal margin. And what intercostal space means is the space between the ribs. The tricuspid valve sounds will typically be heard in the right sternal margin of the fifth intercostal space. And the mitral valve will sound over the heart apex in the fifth intercostal space in line with the middle of the clavicle. This illustration is showing the valves as they open and close. And so when the AV valves open, that's the lub sound. And then when the semilunar valves open, close, sorry, it's the DUP sound. So I had to look back there. I knew it was closed. This is showing the semilunar valves closing. The heart cells are not nourished by the blood in the chambers because diffusion is too slow. And so the heart has to have its own coronary circulation. The left and right coronary arteries are the first branches off of the ascending aorta. The coronary arteries will branch many times, and the entire heart is encircled by small blood vessels. After blood passes through the cardiac capillaries, it enters the cardiac veins. Cardiac veins enter the coronary sinus, which empties blood into the right atrium. This is showing the coronary arteries. You can see them wrapping around the heart. We'll look at blood vessels in the next chapter and go further. This is the posterior view of seeing the coronary arteries from the back side. This is a neat view because you can see how the pulmonary veins join together to empty into the left atrium there. There are some diseases of the coronary arteries, and those fall under the category of arteriosclerosis. From what I remember, sclerosis means like a hardening. And so arteriosclerosis would be the hardening of the arteries. And the main cause of heart attack and stroke is arteriosclerosis. It's the #1 killer in the US and Western Europe. Arteriosclerosis includes atherosclerosis as well as coronary artery disease. Atherosclerosis is the most common form of arteriosclerosis. It starts with injury to the arterial wall. Injury can occur through smoking, hypertension, which is high blood pressure, and diabetes. An atherosclerotic plaque will form, which is the hardening of the walls. This may trigger the formation of thromboemboli, which can break off and form an embolus, it can also may trigger the formation of an aneurysm, which is a weakening of the arterial wall. And eventually it can block the artery itself and cut off blood flow to the heart. So once the blockage occurs, this is coronary artery disease, and it's the atherosclerosis of the coronary arteries. A partial blockage will lead to ischemic heart disease. Angina pectoris is pain in the chest from ischemia. And myocardial infarction is the death of the myocardium. This is also known as the heart attack. A stent, along with coronary bypass surgery, are treatments for coronary artery disease. A nuclear stress test is commonly performed before routine surgery in patients over a certain age range, and it actually has sometimes saved the patient's life because with the nuclear stress test, it tests for coronary artery disease. And so some blockages have been found that otherwise would not have by a patient going in for a routine surgery like carpal tunnel syndrome surgery and undergoing a nuclear stress test where this blockage is then found, and then the patient can get the appropriate treatment before they go and have their other surgery. Now let's take a look at the conduction system of the heart. The cardiac conduction system initiates and stimulates contraction of the atria and the ventricles. The conduction system is intrinsic. It does not require nervous stimulation. Now, yes, the nervous system can affect the heart rate, but it is not necessary for the heart to be stimulated. The conduction system coordinates the contraction of the atria and the ventricles, and the electrical signals will travel from one cell to the next through gap junctions, and those are known as intercalated discs in the cardiac muscle cells. The nodal tissue is going to be the conduction tissue, and it has muscular and nervous characteristics. The first node is the sinoatrial node, or SA node. It's located in the upper posterior wall of the right atrium. This initiates the heartbeat, and so the SA node is your pacemaker. The SA node sends out an excitation impulse every 0.85 seconds, which is around 70 beats per minute, and this leads to the contraction of the heart. A medical pacemaker is implanted in a patient if their heartbeat is too slow, a condition called bradycardia, or if their heartbeat is irregular. The next node is the AV, or atrioventricular node. It is located at the base of the right atrium. The impulse here is delayed so that both the atria will contract together, and it signals the ventricles to contract. Then we move down the atrioventricular bundle, or bundle of His, and they also go into the bundle branches, which travel down the interventricular septum towards the apex. The bundle of His will supply the Purkinje fibers. Purkinje fibers will deliver the impulse to the myocardium of the ventricles and the papillary muscles and cause them to contract. So the first node is the sinoatrial node, which then leads to the atrioventricular node where the signal is delayed, and then it travels down the atrioventricular bundle, or bundle of His, to the Purkinje fibers, which will then initiate contraction of the ventricles. The depolarization of the heart is rhythmic and spontaneous. This spontaneity allows the heart to maintain the threshold without any excitement from the nervous system. This is what allows for the heart to beat on its own. Gap junctions will ensure that the heart contracts as a unit because the electrical impulse will travel from cell to cell, as will ions. There's also a long absolute refractory period of about 250 milliseconds much longer than a skeletal muscle refractory period. This allows the heart muscles to relax and the ventricles to fill with blood once more before pumping occurs. This illustration shows the steps of the heartbeat. And depolarization is going to be due to a sodium influx through fast voltage gated sodium channels. A positive feedback cycle rapidly opens many sodium channels, reversing the membrane potential from a negative to a positive. That's depolarization. Channel inactivation will end this phase. And then in step 2, the plateau phase is beginning due to calcium ion influx through slow calcium ion channels. So this keeps the cell depolarized because a few potassium channels are open. And then in step 3, repolarization is due to calcium channels becoming inactivated and a lot of potassium channels opening. This will allow for potassium ion efflux, or the exit of potassium ions from the heart cell, which will bring the membrane potential back to its resting voltage. An electrocardiogram is abbreviated ECG or EKG. It measures the electrolyte changes within the myocardium. It helps a physician detect the cause of an arrhythmia, which is an irregular heartbeat. Bradycardia is a heartbeat less than 60 beats per minute. Tachycardia is more than 100 beats per minute. Fibrillation is a rapid, uncoordinated contraction. The components of an electrocardiogram are waves. There's the P wave, the QRS complex, and the T wave. The P wave represents depolarization of the atria. The impulse travels from the sinoatrial node to the atrioventricular node. This leads to atrial systole, or contraction. The QRS complex represents the depolarization of the ventricles and leads to ventricular systole. The repolarization of the atria occurs here and leads to atrial diastole, or relaxation. The T wave represents the repolarization of the ventricles and leads to ventricular diastole, or relaxation. Here we see the P wave, and then the QRS wave and T wave. All right, so in this illustration, we see in step 1, when the SA node is firing, it's causing atrial depolarization initiated by the SA node. And then in step 2, with atrial depolarization complete, the impulse is delayed at the atrioventricular, or AV node. And then the QRS complex occurs when ventricular depolarization happens, which begins at the apex. Atrial repolarization is occurring at this time. In step 4, ventricular depolarization is complete. And in step 5, the ventricular repolarization begins at the apex, and that causes the T wave. And then finally, by step 6, ventricular repolarization is complete, and we're back in diastole. The heart's at rest. So this illustration shows a normal sinus rhythm in figure A. In figure B, a junctional rhythm shows the SA node is non-functional. P waves are absent, and the heart is paced by the atrioventricular node at about 40 to 60 beats per minute. In figure C, a second-degree heart block, some P waves are not conducted through the atrioventricular node. Hence, more P than QRS waves are seen. In this tracing, the ratio of P waves to QRS waves is mostly 2 to 1. In figure D, ventricular fibrillation is shown. These chaotic, grossly irregular ECG deflections are seen in acute heart attack and electrical shock. Heart block occurs when the SA node is damaged. The AV node has to take over, but the heart rate is slower, about 40 to 60 beats per minute. An ectopic pacemaker is an area other than the sinoatrial node. Caffeine and nicotine can stimulate the ectopic pacemaker. An artificial pacemaker may be surgically implanted if the sinoatrial node fails to work properly. The cardiac cycle is all the events that occur during one heartbeat, and they include the systole and diastole. The systole is the contraction of the heart muscle, and diastole is the relaxation. So when we talk about atrial systole, that's the contraction of the atria. Atrial diastole is the relaxation of the atria. Pressure gradients are going to move fluids from a higher pressure to a lower pressure, and that will move the blood from atria to ventricles through the valves, and then from the ventricles through the semilunar valves into the arteries. There are 3 phases of the cardiac cycle. In phase 1, it's atrial systole and lasts about 0.15 seconds. During atrial systole, both atria are in systole and the ventricles are in diastole. So the atria are contracting and the ventricles are relaxed. This opens the atrioventricular valves, so both the tricuspid and bicuspid valves are open. And this also closes the semilunar valves. And this ensures that the blood flows from the atria into the ventricles. Remember, the blood flows one way. So in this case, it's flowing from the atria to the ventricles. We don't want it to go back from the ventricles into the atria. Then phase 2 is ventricular systole, so the contraction of the ventricles. And it lasts about 0.30 seconds. During this time, both ventricles are in systole and the atria are in diastole. They are relaxed. This forces the semilunar valves to open as blood is pumped out of the ventricles into the aorta and the pulmonary trunk. At this time, both atrioventricular valves are closed, and that prevents blood from going back into the atria. So again, we're in a one-way flow. Finally, in phase 3, there's atrial and ventricular diastole, and it occurs over about 0.40 seconds. And both atria and both ventricles are in diastole, they're in rest, and the AV valves are open. During this time, the semilunar valves remain closed, which is very important because we don't want blood coming back from the aorta and the pulmonary vein, trunk, into the left atrium. All right, so this is showing some nodes again, and the pathway of the electrical systems through the heart. So the first node is the sinoatrial node, the pacemaker that generates the impulses. And then the impulses will pause at the atrioventricular node. So there's a delay. And that allows for the atria to undergo systole and contract, and the blood to go from the atria through the atrioventricular valves into the ventricles. So then, once the AV node is going to conduct its impulses, they will travel down the bundle of His into the Purkinje fibers. And the Purkinje fibers will depolarize the contractile cells of both ventricles. And then the ventricles will undergo systole and contract. So to follow, here's phase 1. The atria are contracting at the direction of the sinoatrial node. And then there's going to be a small pause as the blood fills in the ventricles. And then in phase 2, the ventricles are going to undergo systole and they're going to force the semilunar valves open. And then in phase 3, both the atria and the ventricles will be relaxed and the atrioventricular valves will remain open, but the semilunar valves will remain closed so we don't get a backflow of blood from the aorta and the pulmonary trunk into the ventricles. The cardiac output is the volume of blood pumped by a ventricle in 1 minute. The average cardiac output is 5,250 milliliters per minute. and it is dependent on two factors, the heart rate and the stroke volume. The heart rate is measured in beats per minute, and the average heartbeat is 60 to 100 beats per minute. You'll usually hear it between 70 to 75 beats per minute. The stroke volume is going to be measured in milliliters per beat. So that's the amount of blood pumped by each ventricle during each contraction. The heart rate can be altered by the autonomic nervous system, particularly the cardioregulatory center in the medulla oblongata. Sympathetic nervous system increases the heart rate, and the parasympathetic nervous system will decrease the heart rate. There are baroreceptors, which are pressure receptors in the carotid sinus and the aorta that provide input for reflexes. The cerebrum will also provide input from your emotions, which will, kind of turn on your stress response or relaxation response. The heart rate is influenced by adrenal medulla hormones. Norepinephrine and epinephrine are going to increase the heart rate. The temperature will affect the heart rate. Lower temperatures will slow the heart rate down. Proper electrolyte balance is needed to keep the heart rate regular. That's why folks who suffer from malnutrition are at risk for a heart attack because of electrolyte imbalance. In this illustration, it shows the regulation of the heart rate. So in this illustration, step 1 shows the baroreceptors in the aortic arch and carotid arteries monitoring blood pressure. In step 2, the nerve signals from the baroreceptors will signal the cardioregulatory center of the medulla oblongata. In step 3, increased parasympathetic signals will cause the heart rate to decrease and normalize. But in step 4, we see that increased sympathetic signals will increase the heart rate. So parasympathetic regulates heart rate, slows it down, and then the sympathetic will speed it up. And then in step 5, the increased sympathetic signals will cause blood vessels to constrict as a result of the sympathetic cue, and that will also raise your blood pressure. The vagus nerve is the major parasympathetic nerve, and it will decrease your heart rate. And then the sympathetic cardiac nerves will increase the heart rate. Stroke volume depends on the strength of the contraction and is influenced by blood electrolyte concentration, the activity of the autonomic nervous system, and hormones from the adrenal medulla. Venous return will affect stroke volume. Venous return is the stretching of the ventricles from the higher blood volume, and that gives you higher venous return. This will increase the strength of contraction and is called the Frank-Starling law. Exercise then will squeeze veins within the skeletal muscle and return the blood faster. The difference in blood pressure also affects the strength of the contraction. The strength of ventricular contraction has to overcome blood pressure in the attached arteries in order for the semilunar valves to open. If there's increased pressure in the arteries, as from hypertension, which is high blood pressure, or arteriosclerosis, the hardening of the artery wall, that will decrease the effectiveness of the contraction. Here are some ways to help prevent heart disease and stroke. Healthy nutrition says adults should eat more plant-based foods such as vegetables, fruits, nuts, legumes or beans, and whole grains, and also choose fish, lean vegetable, or lean animal proteins. Minimize processed meat and sweetened drinks. For exercise, each week adults should engage in at least 150 minutes of moderate intensity activity, such as brisk walking, or at least 75 minutes of a vigorous activity, such as jogging. Tobacco. Each healthcare visit, tell your doctor whether you have smoked any tobacco in the previous month, and if so, work with your doctor to create a plan to quit. Social determinants. Talk to your doctor about factors that affect your health, such as housing, food security, transportation, self-image, and culture. As we all know, socioeconomic pressures can really stress you out. And then aspirin. Because of the risk of bleeding, don't take aspirin for prevention unless your doctor prescribes it. Aspirin can help in some cases, but talk to your doctor about whether it's right for you. And this illustration was provided by the American Heart Association. Thanks for listening.